Assalamualaikum and hi. My name is Hidayah Binti Sabri with metric number BM23110020. So now I will be presenting my SSM video regarding the medical specialty that I choose. Pediatric is the field of medicine providing care for babies, children, and adolescents from birth up to the age of 25. The age range was kept at the age of 18, but given our new understanding of human brain development, the age range has been expanded. It is right when we think that pediatric is the equivalent of internal medicine, but specifically for younger patients. That isn't to say that children are just little adults, because they are not. Children's physiology is different, and certain medication you would use for adults may have dangerous side effect profiles in children. Additionally, because children are more resilient than adults, they tend to crash hard and abruptly, meaning they may seem relatively okay and stable, followed by a sudden decompensation requiring prompt intervention. Just like internal medicine, pediatric is a massive field with a variety of subspecialties such that it is actually difficult to generalize the field. For example, you can take care of patients in a variety of settings, from premature babies to the NICU to healthy children at regular PCP visits to hospitalized children for various rare genetic anomalies. You can view pediatric from a generalist versus a specialist lens. As a generalist, you will be handling a wide variety of presenting pathologies that don't require subspecialized care. If you practice medicine in the inpatient setting, this translates to being a pediatric hospitalist, taking care of kids admitted to the hospital. This may include infectious disease like pneumonia and cellulitis, neonatal issues like hyperbilirubinemia and failure to thrive, or metabolic problems like diabetes, among others. If you are an outpatient generalist, you will be seeing patients in the clinic primarily for regular checkup, vaccination, and less acute conditions like allergies, eczema, constipation, or ADHD. And as a specialist, you focus on a single system of the organ. Similar to the internal medicine, this could be cardiology, gastroenterology, rheumatology, endocrinology, and others. As someone that interested in becoming a pediatric allergy, the organ system that draws my attention is the integumentary system, which is the skin. So basically, the skin has two major layers. The epidermal layer, or the epidermis, which is the most superficial layer where you can see with the naked eye. Next is the dermis, or the deep layer, which is going to be the part that you can see, or the connective tissue layer of the skin. Recall from the previous lesson that I learned during the lecture, we know that the skin is an example of a cutaneous membrane which contains an epithelial layer referred to as the hypodermis, or the subcutaneous layer. This is the layer that is not a part of the skin, but it is very important as it serves as the connection between the layer of the skin and the tissue beneath. The skin is one of the largest and most important organs in the body and comprises approximately 16% of the human body weight. As it covers the entire body, it is essential that all pediatric allergists have a basic understanding of the basic physiology of the skin. The skin is continuous with the membranes lining the body orifice, and in certain areas contain accessory structures such as glands, hair, and nails. The skin is interface between the body and the environment. It has a number of physiological functions that are essential to maintaining homeostasis, protection, and social interaction. One of the most important roles of the skin is protection. The skin protects the body by forming a waterproof layer which protects the deeper structure and prevents dehydration from loss of water. This is due to the keratinized epithelium in the epidermis. The skin also forms a barrier from physical trauma, chemical trauma, microorganisms, and radiation like UV light. Other than that, skin is important for thermoregulation. We know that the human body is kept at a remarkably stable core temperature even in the extreme of heat through a negative feedback system involving the skin, skeletal muscle, sweat glands, and the hypothalamus. This ensures that the body temperature is maintained around 37 degrees Celsius and provides an optimum environment for enzyme-mediated components of metabolism. The third is sensation. So we know that the skin is the main interface between the body and the environment. As such, it has numerous sensory receptors which allow the individual perceive environmental stimuli across a range of modalities. The high number of sensory nerves ending in the skin also provide immediate sensory feedback from the environment to the sensory cerebral cortex. This leads to reflex action, such as withdrawing from a hot object to prevent injury. Next is water storage. The barrier function of the skin is essential for not only protection but also for maintaining normal volumes of water and electrolytes in the human body. The skin contains 18 to 20% of the body's total water content. The ability of the skin to retain water is also important in enhancing the protective function of the skin described above. Furthermore, skin is also important for absorption. The skin, however, has a greater capacity to absorb lipophilic rather than hydrophilic substance. This principle is utilized in the application of transdermal patches or creams to achieve systemic administration of various drugs. Absorption is increased in condition of skin damage where the barrier function is reduced by trauma or disease. Moreover, the skin also helps with expression. The skin, especially over the face, is an essential part of social interaction and attracting attention for social and is therefore essential to the survival of the species. Facial expression is a dynamic tool used by humans to transmit information to others. This can be either innate or learned expression and can express a wide range of emotion, behavior, and communication. Last but not least, skin is involved in the synthesis of vitamin D. In addition to the synthesis of melanin, UV light also converts 7-dehydrocholesterol to cholecalciferol, which is the vitamin D3 in the skin. This process is essential to production and the maintenance of bone by osteoblasts. In normal adults, considerably more cholecalciferol is produced in the skin than derived from food. Skin allergies are actually the most common type of allergies in kids and are more prevalent in younger children. There are several forms of skin condition can be detected as skin allergies in kids. Common skin condition in kids related to allergies can manifest as eczema, an allergic rash, or hives and swelling. Eczema can be found in at least 10% of children around the world. Your child is more likely to have eczema if they have asthma, food allergies, or have a fever. It is often found on a child's face or head, as well as the arms and torso. With eczema, a child's skin is often itchy, dry, and easily irritated. An allergic rash, also known as allergic contact dermatitis, occurs when your child's skin comes into contact with something they are sensitive to. This rash will appear immediately following contact with the allergen. Some people become sensitized to an allergen, such as poison ivy, after one exposure, while other allergens may require repeated exposure before they cause a reaction. Hive and swelling occur following some type of trigger. Hive can occur for a few minutes or hours and even up to a few days, while hive are not dangerous if the child has swelling that affects their breathing, throat, or tongue. Seek emergency medical help immediately. There are many treatments for skin allergies in kids, including home remedies or prescribed treatments from a pediatric dermatology office. Most eczema treatments will consist of at-home remedies. One of these remedies is moisturizing the skin, also act as a preventative measure. Over-the-counter medications such as antihistamine and pain reliever are often used to treat eczema. Your pediatric dermatologist may also prescribe topical or oral medication such as topical steroid cream to help treat eczema. This cream reduces inflammation and itchiness and allowing the area to heal. Treatment for contact dermatitis will vary depending on the severity and cause of the rash. The first aspect of treatment is to wash your child's skin with soap and water. Wash all of your child's skin, not just the affected area. Applying cold compresses to the area will also help to relieve the symptom. And last but not least, so basically these are the sources where we use to refer to all the information in this presentation. As you can see, the sources came from a variety of options such as YouTube, website, and article. And that's all from me. Thanks for watching.